How are you feeling, Nadia? Uh, the great news is that my team and I have been able to locate the source of your illness and have all the tools to help you feel better and get back to gymnastics. I have come up with the diagnosis that you have hypothalamic dysfunction. This is a problem in your hypothalamus, which is a part of the brain that controls the pituitary gland, a gland at the top of your kidneys that regulates most of the body functions, like when you need to drink and go to the bathroom and many other things. Hypothalamic dysfunction is commonly brought on by an eating disorder or a poor diet. We believe that in your case, and because of your dedication to gymnastics and the sort of body standards that you're held to as a gymnast, that you have may have developed an eating disorder or even a poor diet in order to attain your the necessary figure for gymnastics. Your symptoms are very similar to those that are found in anorexic patients who also have hypothalamic dysfunction, and so that's kind of what has led us to believe that you need to work on your diet as a way to start to treat your illness. But in this poor diet, it has actually caused your hypothalamus to not send enough hormones to the adrenal glands right above your kidneys. And so this has actually been causing you to experience symptoms like dizziness, fatigue, hallucinations, excessive amounts of thirst, and urination. And so I guess the complete title as to what I've diagnosed you with is hypothalamic dysfunction as brought on by anorexia in the adrenal gland. We have been able to assemble some treatments that are going to help you feel so much better and get back to gymnastics as soon as possible. Firstly, we want you to start taking medications to replace the hormones that are not being transferred from your hypothalamus to your adrenal glands and thus causing you the problem. So for that, we recommend hydrocortisone, prednisone, prednisolone, methylprednisolone, dexamethasone. And so these are all for a cortisol deficiency, which is the hormone that you're actually deficient of, that your hypothalamus is not producing enough of. So along with taking those medications and this hormone therapy treatment, we strongly recommend that you are seeking help for your diet. We think that talking to someone and maybe even going through a program will help you to learn how to manage your diet while also being able to participate as a top gymnast and balancing both of these necessary body types together. And so by seeking help on your diet and taking these medications, you should be back to normal in absolutely pretty much no time at all. It has been a real pleasure to work with you and to help you start to feel better and give you my diagnosis. I am beyond confident that we have found your illness and that you are on your way to recovery and getting back to gymnastics and doing your flips and turns. I really do look forward to seeing where you go in the future, and please do not hesitate to contact me with any new problems, symptoms, or even if your old symptoms come back, so that way we can work on those together. But I have no doubt that you are on the road to recovery. Thank you so much for all your time and for putting your trust in me, and I hope to hear that you are better as soon as possible. Thank you.